Hello and welcome to the December 2023 Journal Club. I am Laura Quiney, and this month I set out to explore what is new in equine radiography. I was interested to find that quite little has been published in recent years, and that doesn't really reflect the diminishing importance of radiography, nor does it mean that there aren't ways we can expand our knowledge and perfect our technique. But I did manage to find one paper which looked into exactly this question. And it's a paper by Labe and Piggott, which was published originally in Equine Veterinary Education in 2021. It's titled Radiographic Technique to Improve Diagnosis of Sagittal Axial Sesamoid Fracture in Racing Thoroughbreds with Lateral Condylar Fracture. A bit of background into this sort of subset of conditions. Lateral condylar fracture is very much a racing specific injury. And with the concussive and repetitive nature of exercise that racehorses undergo, both in their training and during racing, with the continuum between adaptive bone response and maladaptive bone response, which can then culminate in a fracture, we know it's a very fine line to tread between these two regions in athletes. When fracture does occur, it may well start as a unicortical fracture, which can progress to a bicortical fracture, which has been discussed recently. But often the fracture is identified at the stage where it is a complete bicortical fracture. And the prognosis is determined by the fracture configuration and potential involvement of other adjacent structures. So in this instance, the best prognosis would of course be carried by unilateral or unicortical fracture. But for bicortical complete fractures, it's best if it is non-displaced and with adequate sort of surgical treatment and management and time out, these horses can return to racing with a reasonable prognosis. If the fracture has become displaced, then depending on the degree of cartilage involvement, the prognosis is overall poorer, but these horses can still return to athletic exercise. Now, it has been reported and accepted that when there is involvement of the lateral proximal sesamoid bone, so when there's a sagittal axial fracture, the prognosis is generally very poor. And of course, the worst prognosis is what we'd call a catastrophic lateral condylar fracture with lateral proximal sesamoid bone involvement, which is usually sort of indicated or characterized by a significant comminution, displacement, and disruption of the adjacent and associated soft tissues. And so the exact configuration and involvement of structures in these horses really does have quite a significant bearing on the prognosis and therefore what the likely recommended treatment would be for different horses. So it's really important that we can accurately differentiate between these sort of 4 to 5 levels of severity. The prevalence has been reported to be in the region of about 10% of horses which have lateral condylar fracture may have concurrent sagittal axial fracture of the lateral proximal sesamoid bone. And this prevalence is something that was reported back in the 80s and 90s, and that was following radiographic diagnosis. And from the same time when this was being looked into, in a couple of papers which totaled about totaled 7 horses in case studies, these ones all had a very poor prognosis, and that's where this poor prognosis really comes from, because none of these horses returned to racing, and they all had persistent lameness and a developing degenerative joint disease. And so the identification of concurrent sagittal axial fractures of the lateral proximal sesamoid bone really is imperative for correct prognosis, as well as ensuring the success of investment in treatment in horses with lateral condylar fractures. So typically, horses with these types of injuries would undergo radiographic examination, and a standard protocol would involve lateral-medial, dorsopalmar, and two obliques. In addition to this, it's discussed that typically vets for these racehorses would also acquire a flexed dorsopalmar view, usually three or more. And really, this is in part to evaluate the palmar joint margin for concurrent disease and or fragmentation, which again, the presence or otherwise of this would also have an impact on the overall prognosis in these horses. But in addition, because of the oblique nature of the condylar fracture, usually a series of oblique views are acquired in order to get the best possible view of the lateral condylar fracture and to get as much information as possible. Now, the authors note that typically sagittal axial fractures of the lateral proximal sesamoid bone tend to be very thin, they can be quite small, they can be non-displaced, therefore, and superimposition of the fracture line can occur. Therefore, they determined or sort of noticed that they can be very difficult to interpret, and they mused that actually, it's possible that, you know, in standard views, that this diagnosis could be missed, and therefore, if they're missed, then we could potentially be prescribing the wrong prognosis for these horses, and they may undergo treatment and investment in these horses that is unlikely to yield a sound horse, certainly not for racing purposes afterwards. So they went on to sort of describe and develop a new radiographic projection which could be used to highlight these fractures and improve the diagnosis of them. As well as reading the paper, I also listened to the associated EVE podcast that one of the authors recorded. And they really said that they almost stumbled across this as they were assessing the views, that they noticed that in a shallow dorsomedial view, so when they gone just off the dorsopalmar view projection towards the dorsomedial, so it's almost like a shallow version of a dorsomedial oblique, they noticed that these fracture lines became much more evident, and there wasn't any superimposition of the axial margin of the lateral proximal sesamoid bone. And so this is where this study came from. So their aim was to describe a radiographic technique to assess the lateral proximal sesamoid bone for sagittal axial fracture and displacement. It was a case series, and so there wasn't a rigorous study design here. But what I extracted from the text is that it was retrospective, it was a multi-center case series from two sites in Cornell, so the Cornell Raffian Equine Specialist and Cornell University Veterinary Teaching Hospital. And it was, of course, primarily descriptive case series, and these cases were pulled from the retrospective review of radiographs over a 7-year period spanning from 2014 until 2020. They firstly identified over that time period how many patients were diagnosed with lateral condylar fractures, and so that totaled 124 cases. They were categorized thereafter as displaced by observation of a loss of alignment or continuity of the articular margin. They noted that there are several ways that one could determine the presence of displacement. But this is the way that they chose. Another way would be to document increased gap or the distance between the parent bone and the fractured portion. They then went on to identify how many of these horses had a concurrent sagittal axial fracture of the lateral proximal sesamoid bone. There were 9 in total, 8 of them occurring in horses with displaced lateral condylar fractures, and only 1 of them in a horse with a non-displaced lateral condylar fracture. They further described the proximal sesamoid bone fracture as being either complete and non-displaced, and that was 2 horses, complete and displaced. That was the most common identified configuration, and that was in 4 out of the 9 horses, or comminuted, which was identified in 3 out of the 9 horses. The radiographic projections that were acquired in all of the 9 horses included the standard lateral-medial dorsopalmar, the 45-degree dorsolateral palmar-medial oblique view, and the 45-degree dorsomedial palmar-lateral oblique view. In addition, they had usually about 3 flexed dorsopalmar views, and they also had what they classed as a mild degree dorsomedial palmar-lateral oblique. So this is the view that they were assessing, the novel technique in this study. They then went on to evaluate all of these views in those 9 horses and identify in which of these views the sagittal axial fracture could versus could not be identified. They found that in the lateral-medial, the 45-degree obliques, both dorsolateral and dorsomedial, and the flexed dorsopalmar, in none of those cases could the fracture be identified, so that had 0%. Versus the mild degree dorsomedial palmar-lateral oblique view, in which 100% of the fractures were identified. In the dorsopalmar view, the authors noted that the fracture line was either ill-defined or not visible, depending on the degree of displacement of the fracture. However, they didn't give any figures here as to how many were ill-defined versus how many of these horses were not visible, and therefore, if that additional view had not been acquired, how many of them were only identified because of that view, and how many would otherwise have been missed had that view, extra view, not been acquired. So they didn't give us that information in the study. They then went on to describe that there seemed to be a sweet point in those additional oblique views that they required, at which the fracture line became much more visible. And so they retrospectively went back to try and identify at what point, or was there likely to be one particular point in all these horses at which that fracture line became most evident. And they found that on the radiographs, they could identify the point at which that most information was acquired. And they developed retrospectively 2 anatomical markers of good positioning, which would give this view. Firstly, there was a dotted line, and we can see on both of these radiographs a sort of almost vertically oriented line. This is the point, the midpoint of the third metacarpal bone between medial and lateral. And in the good position, a well-positioned radiograph for this new technique, that line would continue distally, bisecting the proximal distal um, orientation of the limb, and land at the point of the parasagittal groove. And that is what we can see in both of these radiographs. Note that these radiographs are presented slightly differently. So the one on the left, image A, lateral is to the left of the image, and image B, lateral is to the right of the image. So there's a slight inconsistency there, which is slightly confusing to one's eye. Ideally, they would be presented with lateral to the right of the image, and certainly not as mirror images of each other. So just to be aware of that as we go through the images. The second anatomical marker they developed was looking at the degree of superimposition of the medial proximal sesamoid bone over the distal aspect of the third metacarpal bone. So that sweet spot occurred when about 80 to 90% of the medial proximal sesamoid bone was superimposed over the third metacarpal bone, and that's indicated by that thick continuous yellow line. And then the small proportion of the medial proximal sesamoid bone was not superimposed. And as we can see, that is indicated by the solid red line. And so they say that at the point where these 2 markers, sort of anatomical position markers, can be identified, that is the point they believe at which the axial aspect of the lateral proximal sesamoid bone can be best identified and evaluated for fractures. It's a slight limitation, of course, and it's just given the retrospective nature of this study, that the exact angle of oblique projection at the time of acquisition doesn't seem to have been recorded. And so it's very retrospective that the authors then went on to try and determine at what angle of projection would this view occur and be achieved. They did this using computed tomography on two horses in this study which were euthanized. They put the limbs through CT, and using the cross-sectional analysis, they accorded at what angle the widest point of that sagittal axial fracture occurred, and therefore at what angle of obliquity would the beam pass tangentially through that, and theoretically give the best, the clearest view of that fracture. So they measured that at about 20 degrees, but they did note that the fracture orientation of the proximal sesamoid bone was somewhat crescent shaped. And so therefore there was a little bit of leniency either way, where a slightly different radiographic an angle could be used and part of the fracture would still be transected well by a parallel beam. So there is a little bit of leniency there, they believe. But again, this is a little bit sort of theoretical at this stage. So it's quite a logical way to go about it, but it hasn't been put into direct practice yet. So there are some limitations with this conclusion here. Throughout the study, they gave it was a total of 4 examples, which was really great to see, and I think it really highlights what they're talking about and presenting. All of them clearly demonstrate the obvious benefits of this radiographic projection in adding clarity and better visualizing the fracture of the proximal sesamoid bone. However, of all these 4 examples, that whilst they were all much more easily identified on the shallow or mild dorsomedial palmolateral oblique view, they were all identifiable, at least to some extent, in the dorsopalmar view. And what we can see here is we've got 2 sets of images from two different horses. So figure 4, image A is a dorsopalmar, image B is the mild oblique view. And in image B, we can see the fracture line very clearly indicated by the black arrow. Looking at image A, however, it is undoubtedly much less clear, but there is still evidence of osseous disruption here. And similarly with figure 5 on the right here. In image B, we can very see the complete fracture of the axial portion of the lateral proximal sesamoid bone. But looking in image A, which is the dorsopalmar view, we can see that there is obviously a fracture there as well. So we have still got the information on both of these radiographs. What we'll note here is that the mild oblique views were acquired as a flexed view, not as a weight-bearing view. And that's in contrast to these 2 examples here, which is figure 6 and figure 7. The mild oblique views here were acquired in the weight-bearing limb. And again, we have a similar story in both figure 6 and 7, indicated by the black arrows. We can see the lateral proximal sesamoid bone, which in these 2 images is now displayed on the left of each radiograph, is visible in the mild oblique view, image B respectively, but also in both we can see that there is osseous disruption in the dorsopalmar view. They then went on to present the outcomes of these 9 horses. 5 were euthanized without treatment, and 4 went on to undergo surgical management. So this was with lag reduction of the lateral condylar fracture using arthroscopic guidance to guide um, a, a, a proper continuity of the articular margin, but also to provide they also did it arthroscopically, so they could evaluate the joint, any cartilaginous involvement. They evaluated the proximal sesamoid bone and debrided where necessary. Of these four horses, one horse was subsequently euthanized as a result of progressive lameness. And at post-mortem examination, they identified a progression of the proximal sesamoid bone cartilage lesion compared to the degree of lesion identified arthroscopically and associated ebonation of the subchondral bone. One horse was reported to be breeding sound. It was in the region of 2 years after initial presentation. That horse had, I believe, had one foal and was currently pregnant with its second foal. All the information we have is that it was sound enough to be out at pasture and bred from. There was nothing more sophisticated or sort of in-depth done with regards to outcome measures there. Another horse was reported to be pasture sound, so it was turned out and was reportedly fine at walk, trot, and canter. And unfortunately, the fourth horse was lost to follow-up. So this is all very much in support of what the authors believed prior to the study and in association with the previous reports from the 80s and 90s, is that these combination of lesions really do carry a poor prognosis, and it's almost unheard of for any of these horses to get back into any sort of athletic um, exercise. Moving on to their discussion. So they concluded first off that a approximately 20-degree dorsomedial palmar-lateral oblique view, whether it was weight bearing or flexed, facilitated the identification of sagittal axial lateral proximal sesamoid bone fractures. And I think this was really nicely illustrated by the number of examples, comparative examples that they included throughout the text. I think the slight caveat here is that um, saying that these were identified in a 20-degree dorsomedial lateral palmar-lateral oblique view is somewhat of an assumption here. We don't actually know that these were 20-degree views or attempted to be acquired as such. So a little bit of a limitation there, just to be aware of. Um, they did also allude to some fractures only being identified with this view compared with the dorsopalmar, but we didn't see any of examples of this. And being a little bit of a devil's advocate here, whilst it is clear that the fracture examples were all much better identified with the slight oblique view compared with the dorsopalmar, they could all be identified on the dorsopalmar view. And so, with proper radiographic technique and evaluation, did the additional view change what would have been the prognosis and treatment prescribed to these horses if the 20-degree slight oblique view wasn't used? And I don't think at this stage we really know, did it change the outcome in these horses or not? They noted that 27% of horses with displaced lateral condylar fractures had concurrent sagittal axial fracture of proximal sesamoid bone. This is, of course, quite a high proportion, quite a high prevalence. And given the associated poor prognosis, this really does give weight to the importance of a radiographic view which may improve identification. Putting these two things together, they also reported in the discussion that all horses had actually undergone radiography before they were referred. And out of those 9 horses which did have a fractured lateral proximal sesamoid bone, only 2 of them came with an existing diagnosis of this concurrent lesion. So it is, therefore, there's potential that 7 out of 9 of them did not have this identified on the original radiographs. And we don't really know what views were acquired before referral, whether the fractures were truly not visible on radiography versus were they just not reported or were they not seen when the radiographs were evaluated. And so it is difficult to draw strong conclusions from this. But I think it's really important that we don't ignore this, because a potential for 7 out of 9 being missed certainly cannot be ignored. And again, really does give weight to the importance of not only thorough radiographic evaluation in these horses, but the potential for another additional view to yield this information much more freely. They didn't necessarily discuss this in their discussion on the published article, but comparing the historical versus the recorded prevalence wasn't really discussed, and why there was a apparent increase in prevalence between the few studies. They did discuss this in the associated podcast that they did for Equine Veterinary Education Journal. And they discussed that one factor that could contribute to this is the improved interpretation and perhaps knowledge of these lesions. And that is perfectly possible. I think one thing that I think is quite important to consider here is that the quality of images generally acquired in the 80s and 90s with the equipment is far inferior to the images that are being acquired in the last few years over which this study that we're discussing was performed. You know, back in the 80s and 90s, I highly suspect it was all film radiography, and generally it is accepted that the image quality is essentially incomparable to that of the digital radiography systems that we employ today. It really has come on leaps and bounds, and I suspect it's likely that the increase in prevalence is simply as a result of improved image quality. As we know, image quality makes a huge difference. There are several limitations, and I have touched on a few as we go, but there's a few additional ones which I wanted to highlight. Firstly, we don't know how those radiographs were assessed. I don't know from reading the paper whether they looked back through the reports of radiographs versus did they pull up all the radiographs that were acquired in the two hospitals or clinics, and were they all evaluated retrospectively by the same one observer, or was it multiple observers looking for these fractures and for possible proximal sesamoid bone pathology? We don't know whether all the radiographic sets in the 124 horses that they originally identified as having lateral condylar fractures had a well positioned, or what would be classed as a 20-degree dorsomedial palmar lateral oblique view. They did say that all of the ones which had proximal sesamoid bone involvement did have what they would have classed as one of these mild oblique views. But I do beg the question of, did some of those horses which had lateral condylar fractures have a radiographic set that didn't include this particular view? Is it therefore possible that some horses with proximal sesamoid bone involvement were actually missed? Again, this ties into there was a slight lack in consistency of the view, which is a nature of this type of study. And the exact angle of the obliquity was unknown. And I think they did a really valiant effort at trying to determine what was likely the angle that was acquired. And I think it was a really logical approach that they took. But I think this ties into the fact that this wasn't a standard view that was acquired, and it's possible that some of the studies initially included didn't actually include this specific view being evaluated. And again, in a similar vein, there was no comparison against a gold standard. And so, given all of these above limitations, I still ask the question, were any missed? Did some of these 124 horses with lateral condylar fractures have proximal sesamoid bone? And for a number of these regions, did any of them simply get missed? Ideally, to determine the diagnostic usefulness of a modality like radiography, we would need to compare it to a gold standard, whether that's post-mortem, whether that's 3D imaging, CT or MR of these horses. And whilst it's entirely impractical for that to have formed part of this study, it's just a limitation to our overall knowledge of these types of lesions. And our knowledge and understanding of, how good is radiography at capturing these lesions. And I think certainly it's logical that this new view may well contribute to improving the rate of identification of these. And I just wonder whether, if in this series of 124 cases that they initially looked at, if they purposefully included this view in all of those, were there any that would have been subsequently included as having a proximal sesamoid bone involvement or not? The authors did discuss this in a sense that they indicated that they think there were none that were missed, which I think is obviously they're very experienced in this subset of patients. It is just from a research perspective a slight limitation that there is no data to support this observation at this stage. They did then go on to report the outcomes, and again, it really does support that the outcomes of this combination of injuries is poor, and that really does add significance to making sure that we identify horses with this particular combination. But they didn't compare that to the horses which had lateral condylar fracture with non-displaced proximal sesamoid bones, which would have been interesting to, I think, just to give perspective to the importance again of acquiring this view in these horses. So that's brought us to the end of our discussion on this. And I firstly wanted to highlight that I really have focused on the imaging aspect of this case series. And partly because that is firstly what I am particularly interested in with regards to these imaging journal clubs, but also that was the main aim of this study. Just a note that they did go into a little bit more detail on the surgical intervention and treatment of these horses. They did present the results and some nice arthroscopic images of them. And also they went on to in their discussion to discuss the surgical and treatment and surgical outcome and immediate postoperative period in these horses. So if you do have an interest in that, I highly suggest that you do revisit this study. It is available, especially if you're a British Equine Veterinary Association member, it is available to anyone who is a member to read this paper and get a bit more information there. But for the purposes of the main aim of the study and what we're interested in for the imaging side, I did just focus on the imaging side. So just as an aside, if you're interested, the information is very much there for you. But otherwise, thank you so much for listening. I think it was a really interesting paper, and I think whether you're a racehorse vet or not, I think it's a really important learning point to always be aware that we can branch out of any standard radiographic protocol and be a little bit flexible, a little bit inventive to highlight particular regions. We should always be pushing ourselves to ask the question, can I see this better? Can I get more information? And I think studies like this really highlight how important that is, and how important it is for us to keep on questioning, can we do radiography better? So I'm hoping that this sort of technique and outlook on radiography will continue, and perhaps we'll have some more journal clubs looking at different new techniques and views in the near future. But until then, thank you for listening to this one. Do visit our website where you can access more learning information around imaging, whether that's through our Facebook groups, our podcasts, webinars, or journal clubs, or the rest of our content. And of course, our upcoming radiographic training, which is being produced especially for equine vets. So watch this space, and hopefully we'll see you around here soon. Thank you very much.